When IVF doesn't work, the first reaction is usually this: we need to investigate her side further. So the focus shifts there. More scans, more medications, another cycle. But sometimes the real issue is not being looked at closely enough. Infertility is often seen as a female problem, but in reality, male factors are involved in significant number of cases. The challenge is not awareness, it's depth. Most men go through a single evaluation, a semen analysis. If that reports come back to be in normal range, it's often assumed that everything is fine on the male factor side. But that report is only a superficial level of assessment which measures sperm count, motility, morphology. What it does not always reflect is how well the sperm is functioning at a deeper level. And that becomes important after fertilization, because IVF is not just about creating embryos, it also about what happens next, how embryos develop, whether it implants, whether the pregnancy progresses well. Sperm quality influences all of this. There is also a common expectation that IVF compensates for male-related issues, that once you reach the stage of IVF, the role of sperm becomes less critical. But that is not entirely accurate. Even with intracytoplasmic sperm injection or ICSI, the selection process bypasses certain barriers, but it does not eliminate underlying biological factors. Another aspect that doesn't get enough attention is lifestyle. Male fertility is highly sensitive to tobacco use, alcohol, sleep patterns, stress levels, and body weight. These are not minor contributors, they directly influence sperm health. So what this leads to? When this side of the equation is not explored properly, couples may go through repeated cycles, adjusting treatment protocols without addressing a key variable, and that can delay outcomes unnecessarily. To conclude, IVF outcomes are not driven by one partner alone. Looking at both sides with equal depth is necessary, because sometimes the difference between repeated failure and success is simply identifying what hasn't been fully evaluated yet.